Hello, everyone. It's Ann Duffy, and welcome to Dental Entrepreneur, the Future of Dentistry's podcast. I am so happy you're here with me today, and I'm very excited about our special guest today. Let me tell you a little bit about her before I introduce her. Dr. Denise Hale is a seasoned general dentist with over 30 years of experience. She is the president of the Chicago Dental Society. She has held several leadership roles within the Chicago Dental Society, including president of the CDS Southwest branch and the current branch correspondent. As 2025 CDS board president, Dr. Hale has led the planning efforts and preparation for the historic 160th Midwinter Meeting. She is a fellow of the American College of Dentists. In addition, Dr. Hale is a clinical assistant professor at the University of Illinois, Chicago College of Dentistry, served on the board of the Hills Chamber of Commerce, and practices in Palos Hills, Illinois. Please help me welcome Dr. Denise Hale. Hello, Denise.
Thank you, Ann. It's a pleasure to be here with you today.
Oh, I'm so excited because, we were speaking before we started recording how much I love Chicago Midwinter. You guys have always had a fantastic conference. Tell me a little bit about what's new and exciting with Chicago Midwinter this year.
A big new thing for the dentist is we are offering Pankey Essentials One course. It's a 3-day course from 7:30 in the morning to 4:30 in the evening. And they provide lunch. They don't let you escape. They kind of lock you in and you don't get to leave. But it is a fabulous course, especially for maybe some newer docs or some people wanting to expand their practices. The other thing we have that we get a lot of auxiliary at our meeting. We get a lot of dental assistants. We get a lot of hygienists. And this year, it's about time. We're offering a luncheon, and it's going to be kind of like a come and go. It'll have a buffet from 11:30 to 2:30 on Saturday, and it's called Shine and Smile, and it's for the hygienists. So they can come in at their leisure, in and out, and they can do some networking and some seeing colleagues, meeting new colleagues, seeing old friends. And I think it's about time we had something special for them, and I'm really excited that we're having that this year.
Yes, that sounds like something that a female dentist may put together. I don't know. I just feel like
I definitely was all for it.
I bet you are. I mean, that's really nice. And networking, there's so much that can be learned from that. And I think it makes it very rich when you leave and can execute some of those things.
I've always said that dentistry can be a little bit lonely if you don't get together with your colleagues, because not everybody shares your passion for teeth.
Yeah.
So I think this is going to be really nice for the hygienist.
Oh, I think so too. And they can bring that back to their offices and really enhance their careers, which is wonderful.
Absolutely. When we ask our members what they're looking for, a lot of people in general, and maybe it's Americans as a whole, are looking for health and wellness. And we do have quite a few people there. We have yoga. We're going to be offering yoga there again every day at noontime. And then we also have it offered on Saturday morning. I know you said you like yoga, so
yeah.
I might see you over there on a mat.
I think you might.
I'll be just observing. I won't be on that.
Okay.
But they want a lot of health and wellness. And one of my absolute, I had to have her there, was Dr. Torona Lowdog. I don't know if you've ever met Dr. Lowdog. I love her. She's got a limited number of podcasts, and I keep telling her she needs to get more podcasts because I've already listened to them all. And she is very holistic, and I just love her. So she's there on Saturday. She's doing a program in the morning and the afternoon. A lot of people wanted workshops. They want hands-on. And so we do have a lot of workshops this year. I have to say, I think all the hygiene and assistant workshops and courses are selling out really fast. We know that staff want to come and be there. I think it's nice that we offer a 3+1. So for every 3 members of your team that, register for the meeting, the 4th one is free. So it kind of gives an office a little bit of a break. So I think that's a nice thing too.
Yeah, that's a lot of incentive to get everybody there, because I think you have to have everybody on board when you get back in the office.
Absolutely. And I have to put out a little something about our keynote. We have Grant Achatz. He is a 3-star Michelin chef from a restaurant in Chicago called Alinea. He's actually one of the co-owners. And he's very well renowned. Awesome guy. It's very hard to get into their restaurant. I think it's over a year to get a reservation.
Wow.
And so he's going to be there. And he actually is a stage 4 tongue cancer survivor. In 2008, he was at the University of Chicago under the care of Dr. Vokes and his team. I know very familiar with the program because my cousin at the same time had stage 4 oropharyngeal cancer. So Grant is going to be our keynote speaker, and he's going to be emphasizing the importance of dentists doing oral cancer screenings. So I think that's a really important thing.
Well, that's going to be a very powerful keynote, and kudos for you to be able to have him on stage. And it'll be really interesting for him to just see how far dentistry has come and the excitement of where dentistry is going.
Absolutely. Absolutely.
We were also talking earlier, like I also wanted to know, as the founder of Dental Entrepreneur Women, I am very impressed with you that you were the president of the Chicago Dental Society and now leading the 106th Chicago Midwinter Meeting. What inspired you, honestly, Dr. Hale, to rise in the ranks? That is, it can be political at times, and very few women get to where you are. Why and how did you do it?
I've always valued leadership roles, and my family would probably tell you that I'm bossy. So, and I'm organized, and I like things to flow at a certain level. Sometimes you can sit back and let somebody else be in charge, or sometimes you can say, well, you know what? I would like to be a part of that, and I would like my voice heard. And I think too many times maybe women sit back and they wait. I have to be honest, in all the years I've been in dentistry, I have never felt that because I was a woman, anybody really treated me differently. And now maybe that could just be I have thick skin and I don't pay attention to things. I'm not really sure. But I've always felt like my colleagues have always been very welcoming to me. I appreciate that they value my leadership because honestly, I don't want to think that I became the president of this society simply because I was a woman and a box had to be checked. I hope and I believe that people voted for me because they thought I would be a good leader. And that's what I want to be. I want to be known as a good leader, a person who listens to what people want and try to provide for them what they want and what they need to be successful.
I love that answer, honestly, Dr. Hale, because I think sometimes we do take things a little bit personally. And as a leader, you plow through those hard times. And I believe it. I think there's so much room for women in dentistry and leadership. And I'm proud of you for leading the way.
We have a lot of female students now. Our incoming freshman class is 50-50 women. And it wasn't like that when I was in school, but I've tried to tell these women dentists, having your own practice is so valuable, especially if you want to have kids and have a family, because I've had my own practice all this time. And if my kids were sick and I wanted to bring my kids to the office, I could bring them because you know what? I own the office. Nobody's going to tell me I can't bring them there. And there is such value in having your own business, your own office, because you can do that. And why shouldn't I? Because I don't think any of my patients have ever looked at me like, oh, you bring your kids here? They look at you like, wow, that's awesome, because they see what you do. And you're an example to your daughter and to your son about what women can do. And I think that's important. So I try to tell them, try to have your own practice. That way, if you want to take off for a school party, you can take off. If you want to change your schedule to accommodate your family, you can do it. And you can still be successful.
Those are words of wisdom. And what they sometimes don't understand is that it is possible. And it is really important,
Absolutely.
I think, as a woman to be able to make those decisions. Because what I think causes burnout so often is that you get chained to a situation and you feel like you're missing out on things. And you can make those decisions. That's beautiful. Boy, I'm telling you, you're singing my song. I do love that. And I hope that going forward in other situations, even if you don't have your own office, the lead doctor or the lead organization will allow that, because we have to make it so that women can have it all. It depends on what the capacity is and where your wants are. But to be able to make decisions, it really does stem from being the owner of your destiny.
And I think that what you might see changing is the way dentists practice, especially if you're getting more women in dentistry. You may find women banding together into smaller group practices so that they can help each other and facilitate each other. Because I would probably say, compared to my male colleagues, I probably didn't put in the same amount of hours because I personally didn't want to. I never burned out because I didn't do that. And so you might have maybe 1 or 2 or 3 women who come together to own a practice together so that they can work together to make it happen for all of them and for their family life, that work balance. And the young people, they want work balance.
Yeah.
They don't want to be just totally working and they don't want to be totally at home. They want to have a little bit of everything. And I think that's a good thing. People won't get burned out. And then you enjoy what you do longer.
Yeah, exactly. And I feel like that was my history of being a hygienist. I could actually have side gigs that got me where I'm at today. And I loved my profession. I loved practicing. In fact, I miss clinical. I mean, I was in for 46 years of clinical hygiene, and I miss that. I miss that interaction, that I didn't have just that sole focus on 5 days a week, work, 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 work. And I think that is a mindset that the younger generation, we can still make dentistry just an amazing career, and amazing not just for ourselves, but for our patients and the world, and continue to have balance. So I love that you also speak a little bit about that, because you were saying, again, you want to have more of the work-life balance opportunity. Is that covered in the CE? I think we found that that is covered in CE accreditations as well, because we realize how important it is for good dentistry.
Absolutely. And I do think that we're moving in that direction. And I think that's a good place to be. I really do. And because I have seen some of my male colleagues who have devoted so much time to being in practices just burn out quickly. And they're to the point where they don't enjoy their career. And I just think it's a great career. And I really like the fact that I enjoy it. And I'm doing it because I enjoy it, not because I have to.
I love the fact that you enjoy it. And I love the fact that you are a professor at University of Illinois, Chicago, because it's really hard in dental school, and you're giving them hope that there is a great career on the other side, and you can have that career on your own terms.
You sure can. It is a great career. I just told the students the other day, I said, dentistry, we've learned a lot from watching the physicians, seeing what happened to them. And I think that we are going to, for a lot of years moving forward, still have that autonomous practice, that we aren't going to be part of big major group corporations. They're going to be out there. There are definitely DSOs out there, and that model works for some people.
Yeah.
But it's not the majority of the model of practice, actually. Solo and small group practices are still on the rise. So it's good to see. I love dentistry.
Well, just like your keynote, there's a great menu, and you just pick what you want, and you just make sure that you enjoy it and you build on it. It's continuous learning. People that go into dentistry, they're so smart, and you're giving them this opportunity to learn all different career lines, honestly.
And you know, when they go to the midwinter meeting, the other fun thing is we have so many good relationships with each other. Dentists, we look after each other. If something happens to somebody in the dental community, everybody's there to help them out. So midwinter meeting's fun because you connect. You meet new friends, but then you see all your old friends, and you see your classmates from school, and the social end of it I love. But then I love the exhibit hall too, because, you know, I like shopping. I try not to take my credit card with me on the exhibit floor. We have the 6 suds and sales where you can have a few drinks.
Yeah. And then the credit card really comes out. But, you know, the thing that you said, I'm going to touch on that real quick, is like, it is important to show up in person. There's something about the seeing, the feeling, the touch, the smells, everything about being in our community. I know there's so many dudes, women that are going. And of course, if you're a man and you are supporting women in dentistry, you're a dude. So the do's and the do's will be at Chicago Midwinter. We're already talking about where we're going to meet up and what we're going to do. So tell everybody, if you haven't gotten your tickets or you haven't signed up and registered, how do we do that?
You can go to cds.org, go to our website, and you can register for Midwinter Meeting there. You want to try to register before the end of January, because we're still offering the $25 rebate. They did it last year, and at first I was, it's going to be like a virtual credit card thing. But you know what? It was awesome. They had like 100 different things that you could use it for. Like they had Ulta, they had like restaurants. So you would find something you like. And it was really nice to use that. I mean, Amazon, they've got everything on there. But you got to do it by the end of January. You won't get that $25. And if they would have done it earlier, they would have gotten $50. But
well, 25 is good. We'll take it. I can get something at Ulta for 25, I'm sure.
So they can still register. They can still come. And you're absolutely right when you said, people in our field, we like to touch things. We like to feel things. And when you're on the convention floor, you can try that product out. You can hold that Cavitron. How does that feel in my hand? Because I'll be honest, when we had the virtual meeting during COVID, wasn't so hot. It was not good for the exhibitors, because we don't buy an order like that just from looking at something on a screen. We want to see it. I think that's important too for the meeting.
Yeah. And that's why it's such a buzz down on the exhibitor floor. Well, I'll be walking the floor. I hope I get to see you. We'll get a hug for sure. I am positive. And I'm just so thrilled that we got to have this time together. I look forward to seeing you at Chicago and the Chicago Midwinter, and then also just following the rest of your career, because you're not done. As I told you, dental for women, they don't retire. So we're going to keep at it for a long time. Dr. Hale, thank you so much for being with me today. Is there any last words that you'd like to shout out to our audience?
Just, you know what? Come enjoy the Midwinter Meeting. Enjoy. Obviously, Chicago's got great restaurants at night. We have a few fun venues. We've got the Friday night Beats and Bites. That's going to have a DJ. The formal dinner dance is awesome. We have the Chicago Cats. They played last year. I've never heard such a great orchestra. They played the entire time. I've never seen the dance floor that full. And you can wear your gym shoes underneath your gown. It's like a sneaker ball. Your feet are killing you by the end.
Exactly.
Thank you, Ann, so much for having me today. I know I'm going to see you down there. There's a podcast lounge down there, right?
Yeah, I think so. I don't know. I got to find that out. I'm going to have to get involved in that. I don't know what to find out.
I'll expect to see you there and on the yoga mat.
And on the yoga mat. I will be there. Well, thank you so much, Dr. Hale. Give your colleagues my love. And also, if anyone's listening, remember, the most important thing is to keep doing you. Thanks, everybody. We'll see you in Chicago.